Hi, it's Michael Herbert here in the basement of Town Hall at 101 Main Street here in Ashland. Some people call this the bowels of Town Hall. Some people think this is where secret meetings happen. But actually for today and for the last few weeks, it's been really the epicenter of our COVID-19 task force. And I have Sergeant Ed Burman here, who was assigned recently to lead that task force. In a little bit, I will turn it over to him and have him give you a little update on what he's been up to. But just a couple of announcements that I think are important. First of all, public buildings. So last announcement I had made, we had closed them until May 4th. I'm actually going to extend that to May 29th. You might have seen the governor recently. He extended non-essential business closures from May 4th to May 18th. I'm going to give it a couple weeks longer, give us an opportunity to put together a reopening plan for our public buildings and our public spaces. Again, the COVID-19 task force will start working on that next week. I know we're all both a little bit excited about trying to return to some semblance of normal, and we also have a little bit of trepidation. So this is one of those things we need to get right and not necessarily get done quickly. So I'm going to take as much time as I need to make sure that we get a good plan in place. A couple really important things happened at our Board of Health meeting this week. So first of all, nursing homes, the Board of Health mandated that nursing home staff and assisted living staff and rest home staff all be tested for COVID-19. If you've seen any of the news lately, you will see that when COVID-19 gets into one of these facilities, it's really hard to get out. And there is a hypothesis out there that what's bringing it in is not necessarily, it's not from the patients themselves, but it's from staff. And while we have some protocols in place to where patients need to get tested and where residents need to get tested, we don't have anything there for staff. So it's the first community in the Commonwealth to do this, to mandate that staff be tested. And we'll have more regulations and more information about that coming in a couple of days. Also at the Board of Health meeting, they decided to mandate face coverings in public buildings. So I don't have too much information about that. It's pretty self-explanatory, but a number of other communities have taken that approach, and so the Board of Health has decided to do the same, and there will be more information about that coming in the next few days as well. Speaking of public spaces, the farmers market. Obviously, it's one of our most cherished things here in Ashland. They are setting up for a virtual market. Usually they set up on June. The first date, I believe, is June 13th or June 18th for this season. They're setting up a virtual market, but that board is actually working hard to figure out how they're going to open and how they're going to, first of all, conform to whatever regulations are in effect at the time, both at the federal and state level and also at the local level, but then everything that they can do to keep everybody safe, not just the people that come there, but the vendors and also some of the volunteers. So be on the lookout for more information about that. And finally, just a small reminder, excise taxes are due on May 1st. Remember, we extended that from April to May 1st to give residents a little bit of a break. And along those same lines, the Select Board, sorry, still getting used to saying Select Board as opposed to Board of Selectmen. The Select Board voted also to extend property tax due date from May 1st to June 1st as well. So that's for fourth quarter property taxes. Again, if you've paid them already, we thank you. This is actually the money that we utilize to pay for our public services like police, fire, DPW, things of that nature. So it's really, really important just for the operation of the town. I don't know if people make that connection all the time, but that's where your money goes to. And actually, when we start talking more about the budget, there's a lot of tools that we already have online that you can utilize to see exactly where your tax dollars go. They haven't been utilized that much in the past, but hopefully people can utilize it a little bit more in the future. So I think that's about it from me. At this point in time, I'm going to turn it over to Sergeant Burman, who, again, was appointed to lead our COVID-19 task force. And Ed, it's over to you.
Great. Hi everyone. So I thought I'd give you a little update. It's been about 3 weeks since the task force was formed. And I think a lot of people have wondered what we're doing. So the first thing we're doing is we're streamlining a lot of the things that has to do with COVID. And I'm sure a lot of you have seen about on the news about contact tracing and what is that all about, and they really don't explain it. That's one of our biggest functions. So if you go to a lab and are tested for COVID-19, what happens next is if it becomes positive, we get notified right away. The Board of Health gets notified, and what we do is we then assign you to one of our nurses, and that's made up of, we have a public health nurse that works for the town, and our school nurses are assisting in this task. What they're going to do is they're actually going to reach out to you and get a lot of information about you, including some symptoms that you have, and see how you're doing. But then what we do is they're going to ask who you've had contact with where you potentially could have shed the virus to someone. And what then they're going to do is they're going to reach out to your contacts and put them in quarantine for 14 days. This is the way that we try to get the virus to stop shedding and to other people, and to try to, as what they've been saying, flatten the curve or drop our numbers. So we have a system in place. It works really well. Those same nurses, after 7 days, will follow up with you again to see how you're doing. And then they're also a resource for you in case you have any additional questions. A lot of other things are going on. We're working with all of the nursing homes and assisted livings, seeing what assistance they may need. We just were able to give all of our 3 facilities in town face masks for their staff. We're getting calls from the general public. People need masks, different things like that. So anything COVID-19 related comes through our task force, and we assign the appropriate people to it.
So thank you, Ed. I think that was a pretty good overview of what happens here. I can't thank him and again the rest of the team here, especially our nursing staff and our school nurses for what they're doing to help really do what we can to flatten the curve. And the new term I've learned, shed the virus. That's something I'm going to be using frequently now, so be on the lookout for that. Just want to, before we end, just give a real quick shout out to our Ashland Police Department. They have been extremely busy today, but then especially over the last few days with bad guys. You know, obviously situations like this can bring out the best in people, also brings out the worst in people. And then when you start getting confined in spaces for a long time, people get a little stir crazy and unfortunately make some wrong decisions. And also, unfortunately, it puts us and it puts our first responders in harm's way. So really want to thank them for the great work that they've done recently, well, all the time, but especially recently, especially today. They've been quite busy. I'm sure you'll see more about it on the news. So that's about it for this week's update. Again, if you want more information, you can go to our website. Again, it's the Coronavirus 2020 website. Better not be Coronavirus 2021 next year. Hopefully it'll just stay 2020. And you can find that from the homepage of our website. Also, if you have any COVID-19 related non-emergency questions, please call 508-532-7900 or email us at covid19@ashlandmass.com. So again, I'm Michael Herbert, Town Manager, and I'll see you next week.